Of course, you know, this is a very, very big issue, especially with teenagers.
Yeah, so we all wanted to bring in our resident pediatrician, Dr. Don Shifrin, a longtime pediatrician on the east side and with UW as well. And this is I mean, it wasn't an issue maybe, 20 years ago when all your kids are coming through, but now it's just sort of the ABCs. Why is vaping not as good as kids might have thought for them?
Well, that's a great question, Steve. And we actually have two epidemics. One epidemic is at least 300 cases now in 25 states of this mysterious and very serious lung illness, which has already killed one person and put about 200 into the hospital with serious lung problems from an unknown source associated with vaping. And the CDC and the FDA are now investigating this and saying, we don't know why this is going on, but until such time, if you're going to vape, for adults, and we'll talk about the second epidemic, which is teenagers. Yeah. If you're going to vape, do not do it with an off-the-street product, and make sure that if you are having symptoms, which is shortness of breath, difficulty breathing, or chest pain, that you visit the doctor or the emergency room right away. Mm-hmm. Now, the teenage epidemic occurred because we've always had issues with teenagers starting to smoke, right, because, of course, they want to look cool and want to be adult. In 2015, a new vaping pen was invented by the Juul company, therefore the quote-unquote verb juuling, and teenagers have adopted this as the #1 tobacco product that they use. And the FDA has released statistics that say from 2017 to 2018, there's a 79% increase in high schoolers using vaping.
Wow.
From 11% to 22% of high schoolers using this product, which looks like a flash drive. They're using it at school as well. This is an actual flash drive, and it looks exactly like a flash drive. And so it's very easy to hide, and it's very easy to surreptitiously start vaping even in school. So schools are gearing up to try and find these things. Sometimes the only times parents realize their kids are vaping is when they get a call from the school because they can't detect it at home. So almost 1 in 5 high schoolers are using these vaping pens, and it's a serious epidemic because in adults, it's a smoking cessation product. With kids and teenagers, it's a smoking initiation and addiction product.
Okay, I was going to say smoking cessation because I have heard people say, okay, I'm vaping because of, I didn't want the harmful smoke, right? So we did actually have someone text us when we were teasing, that you were coming on the show, and Ron said, I have had 2 lung surgeries due to smoking, so you can't convince me that vaping is bad. What is the proof?
Well, the proof is not there yet because these have only been around since 2007. Okay. So we haven't had experience with these, and there's no question that when you combine propylene glycol and glycerin and with Juul's benzoic acid, which gives you
I don't even know what those are.
A pure hit. Those chemicals, we don't have long-term experience of those, and there's no regulation at this point. So we don't have long-term experience. These Juul pods, each pod has enough nicotine as an entire pack of cigarettes, 200 puffs, wow, and it's a purer hit of nicotine, which will addict teens quicker. So the idea is the FDA, the CDC, and the Surgeon General say under no conditions are these products appropriate for kids or pregnant women.
All right, so we have about 20 seconds left. A lot of parents watch this segment. The kids are going off to school maybe today. What's the one piece of advice you would offer parents who are watching right now?
Just like drinking and driving, just like drinking when you're pregnant, should be a zero tolerance for vaping in your household. So if indeed your child is saying this is a safe product, #1, it isn't. We don't have long-term, and we do have short-term statistics that show that kids that start vaping will eventually start smoking regular tobacco as well. So please, parents, try and figure out if you can discuss this with your kids right away. It's just as important as drinking and driving.
All right, Dr. Don Shifrin, thank you so much for coming in. We really appreciate it.